Dr. Rick Smith, cardiologist on staff at Mon General Hospital, and today we're here at the health fair going through the Mega Heart display. What this is it's an inflatable model of the human heart. Today we're going to be going through the different chambers and different pathologies that the heart may have. We'll first start off going through the right side of the heart, right atrium, into the tricuspid valve, through the right ventricle, and around to the left side of the heart. Once we come out on the other side, we'll be able to tell you more about what we've seen. And now we're going to go ahead and start the tour. Here we are. This is the first stop. This is the right atrium. This is the upper chamber of the heart on the right side. What we're standing beside here is actually thrombus or blood clot. Sometimes this can form in several different things. The most common is what's called atrial fibrillation. That's why we usually recommend that people be on blood thinners called Coumadin to prevent this from forming on the wall of the chamber, because eventually sometimes these can break off and go to other parts of the body and then cause problems such as stroke. You can also get thrombus in the arteries of the heart, which we'll see later on the outside. We're going to move from the right atrium up ahead to through the tricuspid valve to the right ventricle. The right ventricle is what pumps blood to the lungs. We're actually going through now what's known as a ventricular septal defect. What I'm walking through right here is actually a connection between the two heart chambers, the left and right ventricle, which shouldn't be there. It's known as a ventricular septal defect. This allows blood to flow back and forth between the two chambers, which normally doesn't happen. These can be acquired at birth, where the chambers, when we're formed, do not completely come together. These can also happen after things such as heart attack. Usually they will be repaired in younger people and also in older people if they're found. Now I'm standing in the left ventricle, which is the main pumping chamber of the heart that pumps blood out to the body. We're going to be heading up next towards the mitral valve. And actually here on the wall and sort of involved in the valve is what's called infective endocarditis. This is an infection on the valve itself caused from bacteria that gets in the bloodstream and then becomes deposited on the valve. A lot of times this can be treated medically. However, sometimes if the infection is bad enough, the valve will actually have to be replaced. We're actually coming out now through the left ventricle into the aorta, which is the main blood vessel that pumps blood out to the body. This is documenting what's called as an aortic aneurysm, which is an enlargement and a weakening and bulging out of the vessel wall. These are very dangerous and can even be fatal if not treated. On the outside of the heart now, this is actually the left ventricle. This yellow area is documenting an area of myocardial infarction or heart attack. This is where the heart tissue actually has a lack of oxygen from usually a thrombus and causes damage and possibly even permanent damage or death. In treating myocardial infarctions, we usually will try to do what's called place a stent. And that's what these are. Stents are metal coils that go into the artery, are expanded to open up or push the plaque that's built up in the artery out to allow blood to flow through that artery again. A lot of times we're able to do this very well. However, sometimes there's still a need to perform what's called bypass surgery. That is what this is looking at. This is a bypass graft coming from the aorta onto the artery that's involved with blockage. Think of it essentially as a detour, like in your car, around an area of blockage, just like you would detour around an accident or road construction. The bypass will go to where the artery is not diseased and allow blood to flow distally through that to the heart. Once again, I'm Rick Smith. This has been an educational outreach between Mon General and all of us to allow you to have a little bit more in-depth learning about the heart and some of the problems that you may have with the heart. I hope you've enjoyed this. If you have any questions, please log on to the Mon General website, www.mongeneral.com, and we'll try to answer more of your questions. Thank you.